What's up, everybody? It's your girl Jasmine, aka the Nurse RX, and this is where you can get your prescription for all things nursing related. If you're new to my channel, go ahead and hit that subscribe button. You literally will just have the opportunity to gain more knowledge by doing so. You don't lose anything. And if you're not new, welcome back. Thanks for checking in with your girl. How y'all doing? This is my second video that I'm filming today because I'm trying to get more content out to you guys. So that's why I got the same shirt. Still cute though. So today's video is going to be all about what's in my lab bag. So if you find this video a little bit helpful, educational, if you like the video, go ahead and give it a thumbs up so more people can come across this video. And without further ado, let's get right into the video. I never know which way to point. So as I showed you guys in the beginning of this video, this is my lab bag. Now the lab bag, and what I mean by a lab bag, a lab bag is what we use for our skills. And I'm sorry I can't talk because I have my braces in, but we use it for our skills, which we learn all throughout our nursing program. And skills are just your actual hands-on nursing skills that you're going to be needing to use and do in practice. So that's our lab bag. We do our skills during lab. Everyone in my program gets the same lab bag. I think it was about like $250-ish, and we just have to differentiate our bag from other people's bags because during lab we put them all in cubbies and we just take in what we need because this thing is huge. So this is my little, I don't even know where I got this from, but this is how I differentiate mine. I can still remember when I actually got my lab bag. I was so excited. I was like, oh my God, like look at all this stuff. It's so cool. Like I'm finally where I've been wanting to be, which is in my nursing program, because it took me such a long time, y'all. It took me forever to actually get into my nursing program once I decided I wanted to be a nurse, but that's a whole different video. Just know that I was super hyped when I got my little lab bag and we went through everything, and I just thought it was super cool. If you ever have experienced getting your lab bag, whatever they call it in your program, if you get one like this, then you know what I'm talking about. It's just a special like internal feeling. So I have no idea what the order is of this stuff because I've been in my program for a year now, so it's all jumbled up, and there's some things in here that I still have not opened yet. So let's see what's in my lab bag. Okay, so right off the bat, we have this little baggie, and there's a lot of like alcohol pads in every bag. We have some needles in here and some syringes. So I remember this lab. This lab was all about reconstituting medication. And basically reconstituting medication, you will get some medication in practice that comes in like a powdered form. And the reason why you get a medication that comes in a powdered form is because you have to reconstitute it, which means mixing it with a liquid, like normal saline, for example. And when it's in a liquid form, it is powerful for a short amount of time. So you get it as a powdered form, you mix it at bedside, and you give it to the patient like that. So how I have seen it done at my hospital is you literally put it right into the saline bag, and you will squeeze the bag. It'll go inside the little bottle, and then you mix it up, and then you squeeze it back into the actual saline bag. That is definitely something that I didn't know before going into nursing school, that medications come in powdered form. So that was pretty cool to learn. Let's see. And a lot of the stuff that we get, so these are like real needles, but they may not be actually sterile, or they may be old. They're not to be used on real people whatsoever. They're just for practice while we are in lab. So I just want to make that clear. Like the powdered medication I just showed you is not like real medication or anything like that. And then we have a little vial of medication. This is not real medication. This is like saline or just plain water. It's just for training use. Like if you see, it says training use. I don't know if you guys can see that. It's not real. That's the last time I'm gonna say it. A lot of this stuff is not, no. Okay? So For this is how we learn how to actually draw up medication. And we actually have, let me see if I can find, actually it's right here. So these are like all the needles that I have used during lab, and I just put them in this nice little separator. See, like this is the actual needle. This is how they teach us how to open it, like that. And we basically learn how to draw up medications. You actually have to clean the top off with an alcohol pad before you can even draw up the medication. And then the last method that we learn for medication and giving medications are the vial, or the ampules, I'm sorry. So these are the ampules. If I can get it open. So these are the ampules. If you guys can see them, I'm holding them. With an ampule, you actually have to use a filter straw. I have a filter straw right in here that I can show you guys that I've already used. Where is it? It was just in here. Oh, here it is. So this is a filter straw. And the filter straw, if I can show you guys real quick, the filter straw just goes onto a syringe like this. And the reason why you need a filter straw with an ampule is because an ampule is made of complete glass. So to break it open, you take something like an alcohol pad, you wrap it around, and you open it away from you. And the reason why you want to use a filter straw is because once you open it, some glass may have fallen inside. So you want to use a filter straw so it can filter just the medication. And then after you use the filter straw, you will have all the medication inside the syringe, and then you can change it into a needle to actually administer the medication. Let's see what else is in my lab bag. So this is a tracheostomy care tray. I'm pretty sure I already learned how to do this. We never got checked off on this lab, that's why I never opened my own. But basically a tracheostomy is an artificial airway that's basically like right here. It's open, it's an opening where your trachea is. And you just have a little spoolie like this that is used to clean it. And that's basically the main part of cleaning the trachea. You see there's a bunch of other things in here that you may or may not feel like you need to use. Most of it is just gauze. When things come like this, that means that it's sterile inside, and sterility is a key factor in the actual care or the actual skill. So that's why it comes like this, and you'd have to open it a certain way, and you'd have to lay everything out a certain way for it to remain sterile, if it's supposed to be. Okay, the next thing that I see here is an irrigation tray. So this irrigation tray is also for your trach, and the main part of this is just this canister here and this big, what is this, a 60 milliliter syringe. And basically you have the irrigation liquid in here, and you would, you know, get the water up, and then you would irrigate what you're trying to irrigate. Next, I have like a sterile, this is supposed to be like a sterile drape. It just lays out across. If you want to block off an area, you would use this, or if it comes in the packaging, then you would use it for whatever skill you're doing. All right, next, this is a wound dressing kit, and this is actually a skill that we learned first semester. So basically, it's a whole setup, and sterility is super important with the wound. But I'll just show you guys some cool things and things that you'll need when you're doing a wound dressing. So I thought this was pretty cool. It's called a bullseye. It's called a bullseye, and this will just help you measure the actual wound. You can see with this if it's progressing, if it's getting better or worse. This is just a Tegaderm. It's just a clear adhesive, and you see this a lot with IVs, so you can actually visualize the IV without having it get, you know, infected or contaminated or messed with. So that's your Tegaderm. Your major things with wound dressing is going to be your gauze, obviously, so you can actually clean the wound. So you can put something like normal saline. You have your 4x4 gauze in here, and you'd wet it, and you clean the wound from the least contaminated to the most contaminated. So That's the major key with the wound cleanings. And obviously there's more intensive ways of cleaning a wound, but that's just the basics of cleaning a wound that we learned in our first semester. Okay, next, I believe this is the central line dressing cleaning. Central lines are basically a catheter with multiple lumens in it, and lumens just are different tubings and openings. So you often see them like on a neck vein, or they have peripherally inserted central catheters, which you'll see like on the forearm. So that's basically central lines. They can get a lot of blood from a central line, and there's different reasons for having a central line, but the most important thing nursing wise to consider is infection. It's a major concern with central lines, making sure you do not get it infected. So when you're cleaning a central line, you have to wear a mask. And let's see what's in here. It's been a while since I have done this skill. I just know it was difficult to do. You have your chlorhexidine, which I have a new one in here. So you have your ChloraPrep, which is what's used to actually clean around the central line, like the opening where your skin is. It looks like this, and you squeeze it. I don't know if any will come out, but you squeeze it, and there's liquid in here that should come out. It seems like it's all dry here, but that's what it looks like. And then we use this little thing, but obviously in the hospital, it's an actual piece of medical equipment. And after you clean it, you just carefully place this around the central line, and the central line will come out the hole here. It's just a protective layer for the central line opening. Again, your main concern is preventing infection. And then over all of that, you put another Tegaderm. This is the Tegaderm. So this is placed over the catheter. Let's see if I can open it. So these are placed over the catheter, and you can see that it's clear here. So you do want to date and time it so that way you know when it's time to put a new one on and when it's time to do a new cleaning of the central line. There are other steps to it, like changing out the caps. Like this is a cap, so you want to change those out as well. Some facilities, they actually use these caps, which have sanitizing abilities. So it all depends on the facility. This is just some PPE. So you have some mask and you have a gown. I believe this is a droplet gown, but yeah, gown, mask, and there is a face shield in here too. Yep. So like this, obviously. This is our IV kit. So this is not actually inserting the catheter, but this is setting up the IV. So we learned this in our second semester, I believe, how to do a primary and secondary IV. So this is obviously, like I told you guys many times before, just water. And we basically learn, this is your primary IV. You learn how to put the IV and what needs to stay sterile. And then your P-back is your smaller bag. So you'll see something like vitamin K, things that are delivered in smaller quantities. And there is two different types of tubing, if you guys can see. So to do your secondary medication, you would basically just connect it to your primary tubing and let it run like that. So in nursing school, in my nursing program at least, we learn how to actually calculate IV drip rates in case there's no mechanical, electronic equipment to calculate the drip rate. So that's pretty cool. And by that, I mean, we're literally watching how many drops come into this chamber in a 30-second or minute period. So it's pretty time consuming, but in cases of emergency where there's not enough medical equipment, or if you're responding to a natural disaster or something like that, you need to know how to do that. So this is more stuff with the IVs, but this is actually the IV catheter. So actually putting in the catheter. So here is your IV start kit. As you can see right here. So in this, you will find some sterile gloves, which the sterile gloves, they open like this. And there's a special way to put these on so that way you remain sterile. Then you have your tourniquet, which I'm sure you guys have seen before. This is so you can actually increase the pressure and see the veins. You have the ChloroPrep, which if you can see, there's a liquid inside. So you snap it and then liquid will come out. This is probably not real ChloroPrep, but you can see that it's a cleaning solution. You have some gauze and some tape to hold the extension tubing. Then you have the actual catheter, and you can see here that this is a 22 gauge catheter. So this little bevel is the part that you actually stick in facing up. Once you've stuck it in, you're slowly going to inch the needle out. And the different gauges, 18, 20, 22 gauge, just indicate the size of the needle. Okay, I have no idea what this is. We're about to find out. Oh, this is actually inserting a Foley catheter, which was quite an experience. I've never done it in person yet, but on the mannequins, we learned how to do it on a male and a female. It is like a sterile, this is all for sterility. And then this portion of the kit, this portion of the kit is basically just for cleaning. You guys can see that. Basically just for cleaning the area before you put the catheter in. This is the actual catheter that goes inside, and it goes inside for the most part, most of it. And then it has the little urine bag that it connects to right here. And you can monitor how much urine output that they have, and you just hang it on the side of the bed. Never let it touch the floor. And I don't believe this is an adequate measurement. I think you actually have to dispose of it. So dispose of it into something that can adequately measure it. But yeah, it comes with a little syringe, because you may be wondering, how does this not just slip out? And you basically put the syringe in here. Ooh. You put the syringe in here and you put water in it once you apply it, and there's a little balloon to prevent it from slipping out. You see how that expanded? You can see that that little balloon is expanding, and that will keep the catheter in place. So let's see what else. I think there's only one more thing in here besides a urine specimen cup and a pencil that's not sharpened. I have another catheter kit. This is a suction catheter kit. This is basically to suction a trach. So yeah, you're gonna suction with this end. You're gonna put that in there, and it'll be attached to a suction device on the wall, and you basically will cover it and uncover it to suction. This is a 14 French, which just indicates the actual diameter. So it's pretty cool to go and look at all the stuff that I once did not know anything about, and now I actually do know a lot about all the stuff that I've learned throughout this whole nursing program. So it's pretty cool. I hope you guys found this information at least a little bit educational, a little bit helpful, a little bit fun, and you know, it's really exciting when you're learning these skills, how to do it. I did want to take you guys one day to my open skills and my actual lab room and show you guys the mannequins and stuff, but then coronavirus happened, so hopefully I'll be able to show you guys at least in one video all about the skills and labs and actually doing it on the mannequin. So that's all I have for you guys in this video. If you guys like this video, like I said, give it a thumbs up. Don't forget to subscribe and comment down below any questions or anything you want to add to this video. I'll see you guys in the next one. Bye.